So we will discuss the nature and source of drugs. Well, in the context of nature of drugs, there are various natures. For example, first is chemical substances. It might be organic or like inorganic, and it can be like maybe solid or based on the states like solid, liquid, or even in the form of gas, and they may act by interacting with biological targets like receptor or even enzymes, and they even affect based on the effect like therapeutic or even the diagnostic and preventive, or maybe it may have like different nature like toxic, or it may be natural or synthetic. So the nature of drug can be either chemical, or based on the state it might be solid, liquid, or gas, or based on the interaction with biological targets like receptors or even the enzymes. And it can also affect it can have the effects like therapeutic effect, or even the diagnostic, or even the preventive, or like a toxic. And these drugs can be either from the natural or from the synthetic source. Next we will discuss about the source of drugs. Source of drugs, for example, it can be from plant. For example, digitalis leaves, or morphine, or even cinchona bark, or rolfia root, nux vomica seed. So there are many different plant parts which can be a source of drugs. So like digitalis, and then morphine we discussed, and it can be from animal source like insulin which we use for diabetes. It is mainly obtained from pancreas. Then we may have like pepsin from the stomach. So these are also obtained from, and these are obtained from animal. Then cod liver oil, wax or vaccine, or even thyroxine hormone, like which are for used for thyroid. Another source can be from mineral. For example, various salts like ferrous sulfate, and then we have like magnesium hydroxide, and then we have like sodium bicarbonate. And so these are from minerals, these are obtained from minerals. Next we have like microbial sources, like for again we have like penicillin or which are obtained from penicillium bacteria, which acts as penicillin acts as an antibiotic. Then streptomycin, which is obtained from streptomyces, or even we have erythromycin. So synthetic or even the semi-synthetic drugs, like we have paracetamol, or even we have like ampicillin, or antihistamines as like anti-allergic drug, or even sulfonamides. Then we have biotechnological drugs, for example, recombinant insulin means they are artificially derived by genetic modification. Then we have monoclonal antibodies and altiplase. So we discussed about various sources of drugs. First is plant as a source. For example, digitalis, morphine, or even many different plant parts like for example cinchona bark, or even raulfia root, nux vomica. Animal roots, for animal as a source, for example insulin, or even which are obtained from pancreas. And then we have pepsin, which are obtained from stomach. Cod liver oil, then vaccines, thyroxine, which are used as for hormone. And then we have also mineral as a drug source, for example ferrous sulfate, magnesium hydroxide, sodium bicarbonate, and then and many others. Then we have microbial source. For example, we discussed about penicillin, and then we discussed about streptomycin, which are obtained from streptomyces bacteria. So these microbial source also act as a very important for drugs. Because some of the important antibiotics are obtained from these bacteria, like we discussed about penicillin, streptomycin, and erythromycin. And among synthetic and non-synthetic or even semi-synthetic, for example, penicillin, or we have antihistaminic drug ampicillin sulfonamides. And of course, in biotechnological products, like we have recombinant insulin or even the monoclonal antibodies, and then we have altiplase.